Dear friends, welcome to the show Talk with Your Doc. I'm Dr. Prashant Jani, and our guest for today is Dr. Piroze Davierwala. He is Director of Minimally Invasive Cardiac Surgery at Peter Monk Cardiac Center, Toronto General Hospital, Toronto. And we are very happy to have him here in Thunder Bay, and he's going to today guide us about all the frequently asked questions about cardiac surgery. Thank you, Dr. Davierwala, for visiting us here.
My pleasure.
Please tell us about your expertise. What type of cardiac surgeries you perform?
I generally perform the whole spectrum of cardiac surgery, but I specialize in minimally invasive cardiac surgery, which involves doing the same operations that we do by opening the sternum or the breastbone. I usually do them from the side by going in between the ribs, so you don't have to crack open any bones.
So minimally invasive, which less number of sutures post-surgery and rapid recovery probably?
So the main advantage of minimally invasive surgery is less trauma to the patient. It involves less blood loss, and it translates into earlier recovery, shorter hospital stay, and the patient's well-being comes back much faster. So his recovery is extremely quick.
Other surgery is the open heart surgery or the open surgery?
Valve surgery still is open heart surgery, and we do it even through the minimally invasive approach because we do use the heart-lung machine. So when we use the heart-lung machine, it is called open heart, but it's called minimally invasive because we have a smaller incision, which is about 4 to 5 centimeters, and we do not open the breastbone. So that's why it's called minimally invasive.
So what are the reasons for which one has to undergo heart surgery?
Oh, there are several reasons, but I will just focus on the main ones. One is coronary artery disease, blockages in your arteries that supply the heart.
Yes.
That's the commonest, followed by valvular heart surgery. And what is more common in the West is aortic valve surgery, so the valve that is present between the heart and the big blood vessel aorta, which supplies blood to the entire body. And mitral valve surgery, it's the valve which is located between the upper and the lower chambers of the heart on the left side. These are the commonest kinds of valve surgeries.
So most common surgery you might be performing will be the coronary artery surgeries probably, right?
Correct. It obviously depends upon your expertise. There are some surgeons who only focus on valve surgery. So obviously their practice involves mainly valve surgery. Others coronary surgery. I do both because I do minimally invasive, and there aren't many of us doing minimally invasive surgery.
So when somebody has to undergo cardiac surgery for the coronary artery blockage, for example, which is the most common cause probably in the world nowadays.
Correct.
So what are the things one should be worried about before undergoing the surgery?
So it obviously depends on how the patient presents, and I think we should just focus more on the patients who come electively rather than urgent
electively,
emergent. So for elective patients, usually they would present to you with chest pain, what's called commonly called as angina.
Angina, yes.
So we usually, once they are diagnosed with coronary artery disease, then while waiting for surgery, we usually recommend not to overexert themselves.
Yes.
It should not be that they are just lying in bed or staying at home. They can do their outdoor activities, but just not push it to the limit. And particularly if they start getting chest pain, not to push it further, stop. Use their spray, which they have, the nitroglycerin spray if required. And if they have persistent pain, chew an aspirin right away and call 911 if required.
Right. So when the surgery is planned, how do we choose what type of surgery he undergoes? Minimally invasive versus the traditional approach?
Correct. So it involves a lot of medical jargon in that based on what we select the patients. But by and large, patients who have a good ventricular function or the pump function of the heart is good, who are generally lean rather than being extremely obese.
Or,
Such patients are easier to perform through a minimally invasive approach as far as coronary bypass is concerned. And I also prefer to not use the heart-lung machine when I do coronary bypass surgery, so it even further reduces the risk of any complications that may occur by putting the patient on heart-lung machine.
Right. And then otherwise, then the patients will undergo the traditional cardiac surgery.
Correct.
Where you open the chest bone and...
Correct.
So what are the risk factors of either of the surgeries?
So the risk factors, whether you do open sternotomy surgery or minimally invasive, pretty much remain the same.
Okay.
Except that the bleeding complications are generally less in minimally invasive surgery. So the requirement of blood transfusion after surgery is less. And when we do this kind of surgery without the heart-lung machine, the requirement of any kind of blood products is even lower. And whatever blood gets spilled out, we have now with technology, we have machines which clean that blood and we can give the red blood cells back to the patient.
So you mentioned about heart-lung machine. So what is this heart-lung machine and how does it play a role during the surgery of heart?
So as far as valve surgery is concerned, or when we operate on big arteries of the heart, the aorta, it is mandatory that we use because you cannot otherwise operate on these.
So what does this machine do?
So this machine basically takes over the function of the heart and the lung while we are operating on the heart. So we stop the heart because we have to open it. So we have to stop the heart. So the rest of the body has to get the blood supply.
Yes.
And that's taken care of by
this machine.
And because the heart is stopped, the lung also is stopped. So it also has what we call as an oxygenator, which oxygenates the blood.
Right.
So that's why it's called the heart-lung machine.
So this heart-lung machine works as a heart and lung during the surgery. So your heart is not beating at that time.
No.
And then you are performing the surgery.
Correct. It's artificially stopped with drugs, and it comes back again.
And then your heart will come back to normal.
Once you're done with the surgery.
Okay, very nice. Now, on the day of the surgery, when suppose my surgery is tomorrow, what should I worry about for tomorrow?
So generally 2 to 3 days prior to surgery, you would have an anesthesia checkup where they will inform you about all the aspects that you have to follow on prior and on the day of surgery. So they will advise you regarding the drugs, medications that you need to take on the morning of surgery, the cleanliness protocol, having a bath with special soap and solutions for antiseptic precautions. Yes. And you usually report to the hospital in the morning, like at 6 or 7 in the morning when your first case. If you're the second case, the afternoon case, then you report it around 9 o'clock. That's all. So all information will be provided.
Lots of anxiety when somebody has a heart surgery.
Correct.
And there are lots of questions. And I have more questions about that, but we'll take a short break and we'll continue our discussion after the short break.
Sure.
Please stay back because we're going to learn more about cardiac surgery, related complications, and how to be more aware about the cardiac surgeries. So please join us back after the break. Thank you. Welcome back to the show, Talk with Your Doc, and we are today with Dr. Piroze Davierwala, who is a cardiac surgeon and he performs minimally invasive cardiac surgery. Dr. Davierwala, we were talking about on the day of the surgery, what should we do? So now I'm in the operation theater. I have taken all the precautions, and now what happens exactly when I go into the operation theater while my cardiac surgery is being performed?
So you will be brought first to the preoperative holding area, what we call, where the anesthetist assistant will come and put in certain IV cannulas and lines to measure your blood pressure, and then you will be wheeled into the operating room. So the first thing, we will greet the patient and we will do what is called as a timeout.
So how many people will be there in the operation theater?
There are at least about 6 to 7.
7 people surrounding
It includes anesthesiologist, the guy who runs the heart-lung machine called the perfusionist, the surgeons, like 2 of us who are assistants, and the nurses.
So there's a big team standing around me, so I'm really scared, and now I'm going inside the surgery.
No, actually, they are very pleasant. They will always comfort the patient when he comes in so that the patient is calm and cool. And then we'll have a brief talk about the patient, confirming that he is the correct patient, what procedure we are going to do, if there are any risk factors the patient has that we have to be aware about, so that we can preemptively take action.
Right.
And then he will be gradually put to sleep.
Then patient doesn't know what's happening.
No, then he's knocked out.
So then how long is this surgery for the coronary arteries usually?
So at an average, I would put it between 2 to 4 hours, depending upon how many blockages and what kind of surgery you do. So the minimally invasive surgery obviously takes a longer time if we are doing 3 or 4 bypasses.
Yeah.
But if you are just doing 1 single bypass, then it would take about 2 hours. If you're doing 4, it will take 4 hours.
So about an hour per graft probably.
Roughly speaking, if you look at it that way. But it will be about an hour longer than a conventional operation.
So there is a graft involved, right, in the surgery?
Correct.
So what is this graft, and where do you take the vessels from, and how does it work?
So again, it depends upon the age of the patient. At least in my practice, if the patient is 75 years old or younger, I prefer to use what are called as arterial grafts.
Arterial grafts.
Yes, because coronary arteries are arteries. So I prefer that you stick to arteries.
So you take the vessels from the native arteries and then put them?
So you can take 2 arteries from the back of your chest, from inside the chest. You can take arteries from the forearms.
Yes.
And of course, in older patients, then you take veins from the leg. Yeah.
What is the difference between the artery and the vein graft?
So the arterial grafts have been shown that they last longer, like even to the tune of 20 to 25 years, particularly the arteries on the back of the chest. They are as if God has made them for bypass surgery. Yeah, because they are completely different structurally from all the other arteries of the body. So they don't get affected so much by like the disease, which affects other arteries of the body.
So when you put a graft, you just bypass the area of the blockage and connect one part of the open vessel to the another part.
Correct. So it's basically we go at a distance from the blocked area and connect the bypass artery to that area so that the blood supply goes to the muscle. The goal is to supply normal blood to the muscle.
Right. Yeah. Now, is there any blood loss during the surgery?
Yes, of course, there is blood loss during surgery.
How much blood one loses?
It's variable depending upon the surgery, but one would lose about half a liter, I would say.
So every patient needs a transfusion during the surgery or after?
Not really. So a blood loss of about half a liter to 1 liter during surgery, you can manage very well without any blood transfusion because usually the elective patients come with a healthy hemoglobin level. So if he has a hemoglobin of 15, 16, then even 1 or 1.5 liters of blood loss is tolerable quite well. And secondly, we also use, as I mentioned before, what is called as a cell saver. So the blood that is spilled into the operative field, it's sucked out into the machine.
Oh, the same blood is
sort of cleansed, and the red blood cells are returned back to the patient. So if you lose like 1.5 liters, you can almost give back about half of it at least.
Also,
so
the same blood
then the patient doesn't actually lose blood.
So you don't have to have the donor blood to be ready for
it's always ready, yes.
Ready, always ready.
It's always ready because you never know if you land up in a catastrophe, you have to have it ready.
Right. So something happens during the surgery, say some complications.
Yes.
Then who informs to my family members? The surgeon?
Yes, at the end of surgery, the surgeon will definitely go and inform the patient as to what has happened.
But some complication happens and then you might need extensive surgery or something. What happens in that case?
If the surgical time goes way beyond what is expected, then we would ask either one of our assistants or the anesthetist to at least inform the patient.
Right. So
patient's family.
So surgery can last up to 4 hours, say, and then after surgery, then where do I go?
So considering that everything goes well and the patient's preoperative status was good, we send them to a area called as the postoperative anesthesia care unit, short form PACU, and we try and wake the patient up within like 45 minutes and pull the breathing tube out.
What is this breathing tube?
So every patient, because he is anesthetized, obviously cannot breathe on his own. So before surgery, we put in a breathing tube, which is connected to the ventilator or the breathing machine, as we call it.
So the patient is on the ventilator.
Correct, during surgery. And also after surgery till we get him awake and he has the power of breathing himself.
So then you take him to the recovery unit and then you remove the tube as soon as possible. Then what happens?
So once the tube is removed and everything is okay, then he is transferred to the ICU for the night. And of course, depending upon how well he is doing, he may stay there for 1 night or 2 nights.
So when does the consciousness comes back, like start talking and recognizing?
That's right away. Like we don't take out the breathing tube till he's pretty much fully conscious. Because otherwise he may gag on himself.
Right.
So he has to be fully conscious and have normal power before we remove the breathing tube.
So after the breathing tube is removed, then he can eat normally?
Not right away. We would wait for some time because till he's obviously a little drowsy after we remove the tube. But and once he wakes up well in the next 3 to 4 hours, then we first start with just ice chips. Then we move to a little bit of water. And then the next day he can even have a normal breakfast.
And then how long one has to stay in the hospital after the cardiac surgery?
It's usually up to for 5 days.
5 days?
But I would say between 5 and 7 days would be a good ballpark figure.
So after 5 to 7 days, he can be discharged.
And for the minimally invasive surgeries, especially bypass surgery, we are trying now to send them home on day 3.
Okay. Third day.
If everything goes well and he's up to it, then he or she is up to it.
Thank you, Dr. Davierwala. We'll take a short break and we'll continue our discussion. Please stay back for the last part of this discussion. We're going to learn more about cardiac surgery from Dr. Davierwala. Thank you so much. Please stay back. Welcome back to the show Talk with Your Doc. Today we are talking with Dr. Piroze Davierwala, who is a cardiac surgeon, and we are learning about frequently asked questions about cardiac surgeries. Dr. Davierwala, we are talking about discharge after the surgery, like patient stays 3 to 5 days and he's discharged. So once one is discharged after the surgery, when can one return back to work?
So it depends upon the type of surgery he's undergone. So the advantage, therefore, I mentioned before, in case of minimally invasive surgery where we don't open the breastbone, the patients have no restriction after surgery. They can do whatever they like. They can drive, they can ride a bike.
After how many days?
Well, a week or 2 after surgery.
1 to 2 weeks after the surgery?
Yes. And that's not because the heart doesn't allow or the surgical site doesn't allow. It's just that after any kind of surgery, mentally the patient has to come back to his normal. The fluids in the body have to come back to their normal levels. So sometimes the patients have dizziness when they get up. So all that, once it settles down, then they can...
So that's about 2 weeks.
Correct.
So during these 2 weeks post-surgery, are there any restrictions for the patients?
So there is a restriction on driving or riding a bike. for minimally invasive surgery. For patients who undergo conventional surgery by opening the breastbone, obviously these restrictions are prolonged to about 8 to 12 weeks.
Okay.
Because, again, not because of the heart, primarily because when you open the breastbone, it's like a artificial fracture. So, you know, any artificial fracture takes about 8 weeks to heal. And secondly, it has to be stabilized. Any fracture is stabilized. So because it needs to be in a stable position, you cannot, raise your arms above your head, preferably not to lie on your chest, not to bend down, not to drive, not to lift heavy weights. So these are certain restrictions they have to follow for
So
conventional
minimally
surgery.
invasive surgery, one has to take precautions for 2 weeks, while in the open, like a traditional surgery, one has to have those restrictions for 6 to 8 weeks at least. Yeah, and then one can come back to the normal.
Yes, so after 3 months, it pretty much doesn't matter.
Normal life. Is there any exercise which is recommended for after the surgery, like for minimally invasive as well as traditional approach surgery?
So cardio training is extremely important. So taking walks, gradually increasing the duration of your walk to almost 45 minutes, brisk walk every day non-stop is the best therapy. They can do walk on the treadmill or walk outside. They can do a stationary bike if they are for conventional surgery, because they are not recommended to ride a normal bike outside. So these training exercises are extremely important. And then once it's past 3 months for conventional surgery, then they can do weight training and whatever yoga and such things if they like to.
Are there any medications after the surgery to be continued, and if so, how long?
Yes, so for patients with coronary artery disease, most of the medications continue because, as I always tell my patients, we are not taking your disease away. We are just making another route for the blood to reach your heart muscle. So the disease process continues. So all the medications that are given for the risk factors, they have to continue. So to lower your blood pressure, you have to take antihypertensives, you have to control your diabetes with anti-diabetic medications. You have to give them blood thinners, so that, like aspirin and certain other drugs, so that the blood flow continues.
All medications continue?
Pretty much.
Any additional medications after the surgery to be added?
Usually not, unless the person's heart function is not very good. Then we add certain special medications for heart failure, which spruces up your heart function.
Is there any risk of pneumonia after the surgery?
Yes, there's always a risk of pneumonia because what we call as ventilator-associated pneumonia. If the patient remains on the ventilator for maybe 2 or 3 days, then that risk of ventilator-associated pneumonia increases.
So that happens 3 days after the surgery?
It can happen even after 48 hours. And that's the reason we try and shift them to the PACU and get them extubated as soon as possible.
So then he might need antibiotic probably for some time.
Correct.
Yeah. And then early mobility is the key to prevent the complications.
And we also give a breathing machine which is called as a spirometer, where the patients are encouraged to breathe as deeply as possible. Because the patients generally tend not to breathe well after surgery because they are lying down, and secondly, they have some pain, so they are fearful of expanding their chest as much as possible because of the pain.
So as you mentioned that the cardiac surgery is not a cure for the disease, it's just a patchwork. And if you really want to cure the disease, you have to have a lifestyle modification probably. Is that correct?
Correct.
So lifestyle modification may include like regular exercise. Anything else would you recommend?
Changing your diet.
Yeah. What does the diet change include, like, for example?
You have to have a healthy, well-balanced diet. I mean, you don't need to stop everything or certain things, but a very well-balanced diet. And we always have a dietitian as well in hospital who recommends the diet changes. You also, going to a rehabilitation center, 2 to 3 weeks after surgery also does help, because it not only they advise the patient on how to exercise, but they also provide diet information.
Dietary exercise,
Yes.
and then smoking cessation. And
Of course, those risk factors.
Risk
So they are
factors.
called as the modifiable risk factors. There are certain unmodifiable, like your family history,
Genetic,
you
yeah.
cannot change that.
Yeah.
You have those genes, you cannot
Yes,
change those.
yes.
But you can definitely modify smoking
yes.
habits,
diet, lifestyle, exercise.
and other modifiable factors like hypertension, diabetes. And so.
Right. And anything else would you recommend to the patient, like any resources you have or any websites or anywhere else patients can read more about the cardiac surgery related questions?
So most of the hospitals which do cardiac surgery have their some information about the disease and how to get about the disease on their website. So I would recommend them to go to some of the famous hospitals
Yes.
rather than just Googling
Yes.
Dr. Google, as it's called.
Thank you, Dr. Davierwala, for coming and being part of this show.
It's my pleasure. It was a pleasure to be here on the show.
Thank you, everyone, for joining us today.